Okay, so for the first step for the manual vacuum aspirations, I'm going to go through just patient expectations for the procedure and kind of the consent procedure for the MAs and the nurses and any providers. So as far as expectations for the patient, they're usually going to arrive 15 minutes prior to their procedure. They're going to be taken to a waiting room where we're going to administer the medications and go through the consent process and have them sign the consent. They'll be in that room for about 30 minutes because we do give an anti-anxiety medication and pain medications. We want to make sure there's plenty of time for those to settle in. After 30 minutes, you will accompany them to this room, and it's a two-step procedure. So we'll alert the providers that they're ready, they're undressed from the waist down. We have a place for their partner, support person to sit. So step one, the provider will come in and do the block, which is just some numbing medicine around the cervix and up inside the uterus. We will take them out of stirrups and let them just kind of relax for at least 15 minutes, and then we'll come back and do the procedure, the manual vacuum aspiration. Patients should not feel much. They might feel a little bit of cramping. They shouldn't feel pain, and if at any given time patients are getting too uncomfortable, we can stop, give more numbing medicine, or we can just stop the procedure and schedule them to be in the operating room. And also the patients can expect to hear a little bit of suction sound as we're removing the pregnancy from the uterus. We're hopefully going to have some music. We're going to offer that they can listen to headphones as well if this is uncomfortable. Now for the consent process, the patients are going to get a information sheet that gives them information and kind of a little about what I just told you, but also for the consent process, I always tell patients overall the procedure is very, very safe and very, very few complications, but there are inherent risk of uterine infection. So we always give antibiotics prior to the procedure, just 200 milligrams of doxycycline. Occasionally we'll give it after, but usually just one dose is enough. Small risk, anytime we put anything in the uterus, there's a small risk we can perforate a hole through the uterus. It's a very rare risk, and rarely do we have to do anything for that unless there's a lot of bleeding or we suspect there's damage to the surrounding organs, which again is very, very rare. There can also be a risk of bleeding. We of course are trained to deal with heavy bleeding, and it would be very rare that they would have to be transferred to the ER or have to undergo subsequent procedures, but that is a risk as well. And like I said, there's a lot of studies showing that if you have a manual uterine aspiration or a vacuum aspiration after a miscarriage, most women go on to have totally normal pregnancies after, and there's not usually any kind of problem with scar tissue. That's it.